Our next guest started a battle with her teeth at just 2 years old, and we're not just talking about teething. That fight followed her through adulthood. For the first time in decades, Phyllis Sikes can eat and smile with confidence and comfort. She can enjoy the food at the holiday table this year. It's all thanks to the life-changing procedure with Dr. Michelle Azar at the Texas Dental Implant Center. A lot of people, when they are dealing with missing teeth, say they can't wait to eat something again. You couldn't wait to smile again.
Right. To wear red lipstick and draw attention to my smile again. You know, that's something I haven't been able to do since ever.
Your entire life, because
Pretty
you had your
much.
first dental surgery at 2 years old.
Yes, I've had more oral surgeries than I even can keep track of these days.
All right, Dr. Azar, a lot of people think if there's something going on with, the baby teeth, no big deal, it'll straighten itself out with permanent teeth. But oftentimes that's an indication you'll have problems later, as Phyllis did.
Correct, yeah. So if you're genetically more prone to decay or losing teeth, then it will carry on to the permanent teeth. So it's good early on to get some intervention, so that we call it the space maintenance, so that the permanent teeth know where to grow or where to erupt.
Yeah, a lot of things have changed in dentistry since Phyllis first started having these problems. And one of those things that has changed is the new form of dental implants. And we'll get to that in a minute. But in between that time, Phyllis, you had to have surgery after surgery after surgery, to the point where you would walk into any dental office with high hopes, but leaving hopeless.
Just dread, absolute dread. I've never gotten a chance to just have a normal dental experience due to the surgeries and things like that. And, walking into Dr. Azar's office, so friendly, so kind, no anxiety.
And no anxiety, because you knew finally you were finding something that could work. All right. So in her mouth, she had a problem with not producing enough saliva. I guess they call it Sjogren's?
Correct, yeah. So she has an autoimmune disease where it attacks the salivary glands, and then it makes a dry mouth. And dry mouth generally would get more decay faster than usual.
Yeah, oftentimes people, after they've been from dentist office to dentist office to dentist office, they feel so defeated when they walk in. They feel embarrassed when they walk in. You know that. That's why your office, you all have gone through actual training to make sure that you understand how people come through those doors and how to receive them when they do.
Correct. So for Phyllis, for example, her main concern was, how am I going to get through the surgery part? She's scared, like everyone, from the dentist or from the dental procedure. And just by breaking that barrier, when we met her for the consultation and then we explained the whole process, she was just more comfortable to get the process done. And then we get the anesthesia, so she was basically sleeping or half asleep during the procedure, and that we were able to accomplish a lot in one day.
How important was that for Dr. Azar to explain to you what they were going to do, as opposed to just doing it?
Right. No, that was actually very important to me. I had done a lot of research on dental implants before doing it, and there's a wide variance of what you'll read when you're doing research online. So to have him walk me through that and let me know what that was going to look like, that put me at ease quite a bit.
Yeah, and the reason why there's a wide variance is that it's not a one size fits all. Everybody's mouth is shaped differently, their needs are different. For example, for Phyllis, you felt it was better to just start with a clean slate, but that didn't mean that you had to put an implant in every space that there should be a tooth.
Correct. So in her mouth, we had to start from the beginning, and I told her that up front. And then normally for each jaw, we place 4 to 6 implants that will fit a whole size teeth or full set of teeth. What makes our process really worth it is that we go through a try-in phase. I know from patients who had the consult done with us, they hear about next day finals or the teeth the next day, but the problem is that you're stuck with these teeth for the rest of your life, and you don't get to choose much about the shape of your teeth.
Because the thing is, if you're talking about somebody who hasn't had teeth, functional teeth in their mouth for a long time, like Phyllis,
they probably forget how it feels like.
First of all, you're taken aback by, oh, look how wonderful they are, but you get to settle into them. When you talked about that try-in phase, you got to settle into them and make little tweaks, which was important for you because you're a vocalist.
Yes, so small things like widen the arch. Another thing that we paid attention to was the midline of the teeth. And it really was, just such small changes like, okay, we're going to move it to a millimeter to the right or a millimeter to the left.
Yeah. What was it like when you came out of surgery and you looked in your mouth the first time?
I wanted to cry. I wanted to cry. I was like, I have a smile again.
Yeah. And for you, it was about being able to wear lipstick. No.
Yeah.
but you know, what was the first thing that you ate and you were like, there was no fear of, because you wore dentures for a long time in your 20s.
Right. So the two big things I probably was most excited about was corn on the cob and an apple, just a whole apple.
Yeah, things that people take for granted. All right, so dentures was the way that we used to go for a while, and some people still find themselves using those. But the problem with those is that your mouth can still lose bone. That's why a lot of people are told, well, you're not a candidate for implants because you lost too much bone. But you are an expert in this. Don't let that keep you away.
Correct. The problem with dentures, when they're worn for so much or so long, the bone tends to resorb. And that happens more on the top jaw. So the main challenge for us is to come up with new techniques or new ways to anchor implants to where bone is. So these are called advanced bone implants, like zygomatic implants. We anchor the implants to where the bone doesn't resorb, and then that's a very solid structure. And we're known for that, and we get referred from different dentists as well.
Yeah, you're known for very complicated cases as well.
Correct.
All right. When it comes to paying for it, you know, that's one of the things that stops people from coming in. They think that the cost, and it does cost to get your bite back, and that's priceless to you, right?
Right,
And what you got in return is
absolutely.
priceless, but you work with people.
Correct. So two main things that makes us special. One is that we have our own in-house lab. So that helps me to minimize the cost of the overall materials, and I pass these savings to the patients. And second is that we work with payment plans. So we know that everyone wants to get it done. We just want it to make it easier for you to get it done.
Yeah, and it helps to reduce the cost in the sense that, like you said, it's all in-house. You're not sending them to a specialist across town, a specialist here, and drawing it out. It happens all at one time. What do you say to somebody who has been putting it off?
I think that, you know, you should at least go in and get a consultation. They made the process so easy. Financially speaking, they're more than willing to work with you, work with your insurance. I would just say get it done sooner than later, because it is very well worth just the self-esteem alone.
Yeah, we talk about self-esteem and aesthetics, but it also is your health, because now you can eat the wide variety of foods that our bodies need to maintain our health. The Texas Dental Implant Center has this offer for Great Day viewers. The first 20 callers will receive a complimentary consultation with Dr. Azar and a free 3D scan after a short pre-qualification call. If you suspect that you have periodontal disease and need to turn things around, or you've already lost teeth, schedule your appointment now. The number to call, 713-322-5056. Again, that's 713-322-5056. To learn more about the Texas Dental Implant Center, visit bestdentalimplantshouston.com, bestdentalimplantshouston.com. They are skilled in most all dental issues and can handle the most severe cases, as you heard.